Of rapid maxillary expansion. So in this part we will learn about the appliances that are used for rapid maxillary expansion. So we know that the types of appliance. So we know there are two types of appliance. It can be broadly classified into removable and fixed appliance. So removable appliance are the one that can be removed by the patient on its own, and the fixed appliance are the one that are fixed by the doctor or the clinician for a particular period of time until the rapid maxillary expansion is desired. So fixed appliance are of two types, that is tooth bone and tooth tissue bone. So further we will see what are the types of tooth bone appliance, what are the type of tooth tissue bone appliance. So let us see a picture about a removable removable rapid maxillary expansion appliance. So this image, all you can see on your screen is the image of a removable appliance incorporating a jack screw for arch expansion. So this is a removable appliance in which there is a center jack screw that causes the expansion. So this jack screw causes expansion of the palatal shelves. You can see that there is an acrylic plate appliance that is supported over the palate, and there is clasp given around. See here, you can see it, there is a split acrylic plate with a midline screw. The appliance is retained using clasp on the posterior teeth. So these clasps that are given are used to retain the removable appliance over the palate. So you have many of you have mainly have fabricated this appliance, removable appliance, not the rapid maxillary but the appliance such as Adams, such as Hawley's appliance. These appliance which you have fabricated during your clinical postings, these appliance are all retained with the help of screws. So the removable appliance are retained with the help of clasp on the posterior teeth. So this appliance needs patient cooperation, and it is difficult to retain because this screw and the activation of the screw causes a lot of pain while it is placed in the mouth. You need a lot of patient cooperation when you use such type of appliance. Hence it is not commonly recommended. It's not because the patient age is around, the child is around 8 to 16 years of age. The patient is not willing to use this appliance. The 8 to 12 years old patient is not willing to use this type of appliance because it needs a lot of patient cooperation. So we have switched to another type of appliance, that is a fixed appliance. This is the most commonly used appliance. It does not require patient cooperation because to reinsert the appliance is not required. So this appliance is fixed for a particular period of time into the patient's mouth, and it is only removed by the help of the clinician. So the two commonly used fixed appliance are tooth bone and tooth tissue bone. So first is the tooth tissue bone appliance. The tooth tissue bone appliance, tooth plus tissue. Tooth plus tissue appliance is of two types, that is Haas type and Derrick Swiller type. So we will give it a short form as HD. Haas type and Derrick Swiller. Type. So this type of appliance is tooth and tissue bone. So let us see the diagram. So first diagram, you can see it is a Derrick Swiller appliance. You can all see that there is an acrylic plate. This acrylic plate takes support from the tissues, and the clasp that are given take support from the tooth. So this appliance, by just looking at the picture, you can find you can make out that it is a tooth plus tissue appliance. Similarly, you will go to the has type. You can see that it is having an acrylic plate and it has clasp, so hence it is called as tooth plus tissue appliance. Similarly, you can see the next type is the tooth bone appliance. It is of two types. Short form you can take it as Hyrax and Isaacson. So first you will see the Isaacson appliance. By looking at the appliance, you can see something is missing, that is acrylic. There is no acrylic, hence it does not take support from the tissues. It only takes support from the tooth. Similarly, you will see this is the Hyrax appliance. It has a screw. It is also known as hygienic rapid maxillary expansion appliance. So it also does not have acrylic, hence it is only taking support from the tooth. So let us learn about this appliance in detail. First is the Derrida-Swiller type. In Derrida-Swiller type, the first premolar and the first molar are banded. So look at the appliance. You can see the first molar and the first premolar are banded. Okay. The wire tags are soldered into the palatal aspect of the band. The wire tags are inserted into the split palatal acrylic plate incorporating a screw. So this palatal tags which are there from this clasp, it is inserted into the acrylic plate, and that acrylic plate consists of a midline screw. Then the next we will check the has type. Has type, in this the first premolar and the molar of either side are banded. So the first premolar and the molar of either side are banded. A thick stainless steel wire. So this is, you all can see this wire here. This wire here. One second. This wire here is a thick stainless steel wire of diameter 1.2 mm. 1.2 mm diameter. It is soldered on the buccal and lingual aspect connecting the premolar and molar. So first it is banded. First the four tooth are banded. Then you have a thick stainless steel wire that connects the buccal and lingual end. And the lingual wire is extended and folded into the acrylic plate with a midline screw. So this appliance is the has type appliance. So here you can see the difference between the two appliances. In the Derrida-Swiller appliance, only the band was applied to the four tooth. Here along with the band you can see a stainless steel wire is incorporated in the buccal and lingual aspect. Next you will check the Isaacson appliance. Isaacson appliance uses a special type of expander that is known as mini expander. MINNE. This is a mini expander which is in between. This expander, in first the premolar and molar are banded. Then you have a wire that is soldered. The expander consists of a spring coil. So this expander, mini expander which is there, it has a spring coil. So this spring coil which is present, it is compressed and the compression is released little by little, and hence it causes expansion of the palatal shelves. Next you will check the Hyrax type of appliance. It is also called as hygienic rapid expander. The screws are of heavy gauge and the expansion are adapted to follow the palatal contour. The only difference here you can see is here it follows palatal contour. This wire which is soldered on the lingual side follows the palatal contour and it has the midline screw. So these are the 4 types of appliance, fixed appliance, that are most commonly used, and it helps in expansion of the palate of the maxilla. Then you will see about the activation schedule. What are the activation schedule? Various authors give different activation schedule. First is scheduled by Timms. So Timms gave for patient up to 15 years of age a 90-degree rotation in the morning and evening. So Timms, he recommended for patient up to 15 years age a 90-degree rotation morning and evening, and for patient over 15 years a 45-degree activation 4 times a day. So you have to remember, this is question is asked to explain the activation schedule. So first Timms what said, for patient below 15 years up to 15 years of age, 90-degree rotation 2 times a day morning and evening. For patient over 15 years of age, 45-degree rotation 45-degree rotation 4 times a day. This is 2 times morning and evening. Next, scheduled by Zimring and Isaacson. Zimring and Isaacson was for young growing patient 2 turns each day for 4 to 5 days. So for the first 4 to 5 days you will give 2 turns per day, and then later 1 turn per day until the desired expansion is achieved. Okay, so first this schedule was given by Timms and this schedule was given by Zimring and Isaacson. So this is all you must know about rapid maxillary expansion. First, in the first part we have covered contraindications, indications, uses, and why it is done. And in this video we have covered about the appliance, the fixed and the removable appliance. The fixed appliance are most commonly used. You can draw these diagrams for the fixed appliance and then mention the activation schedule for each of the appliance. Thank you for listening, and follow and subscribe for more videos.